Blood in stool is a concerning symptom that can be indicative of various underlying health conditions. It can be caused by a variety of conditions, ranging from minor to serious. Common causes include hemorrhoids, which are swollen blood vessels in the rectum or anus, often caused by straining during bowel movements. Anal fissures, which are small tears in the lining of the anus, usually due to passing large or hard stools. Diverticular disease, characterized by small pouches that can form in the walls of the digestive tract which can bleed. Inflammatory bowel disease that includes Crohn's disease and ulcerative colitis, which can cause inflammation and bleeding in the digestive tract. Colorectal polyps or cancer characterized by abnormal growths in the colon or rectum that can bleed. Gastrointestinal infections caused by bacteria, viruses, or parasites can cause inflammation and bleeding. Peptic ulcers, sores in the lining of the stomach or duodenum that can cause bleeding. Angiodysplasia, which are abnormal blood vessels in the gastrointestinal tract that can bleed. Certain medications, such as non-steroidal anti-inflammatory drugs or blood thinners, can increase the risk of bleeding. The presence of blood in the stool can present with various symptoms depending on the underlying cause. Bright red blood in the stool or on toilet paper indicates lower gastrointestinal bleeding, possibly due to hemorrhoids or anal fissures. Dark, tarry stools, also known as melena, indicates bleeding from higher in the gastrointestinal tract due to conditions such as ulcers or esophageal varices. Abdominal pain associated with conditions like inflammatory bowel disease, diverticulitis, or infections. Changes in bowel habits such as diarrhea or constipation may accompany bleeding in conditions like colorectal cancer or IBD. Weight loss and fatigue, common in chronic conditions like inflammatory bowel disease or cancer. Chronic blood loss can lead to symptoms of anemia such as fatigue, pallor, and shortness of breath. To diagnose the cause of blood in the stool, a healthcare provider may perform medical history and physical exam to assess symptoms and risk factors. Fecal occult blood test to detect hidden blood in the stool. Blood tests to check for anemia or signs of infection. Procedures like colonoscopy or sigmoidoscopy to visualize the inside of the colon and rectum. Imaging tests such as CT scans or MRI to identify abnormalities in the gastrointestinal tract. And taking tissue samples during endoscopy to check for cancer or other conditions. Treatment depends on the underlying cause of the bleeding. Hemorrhoids and anal fissures are often treated with over-the-counter creams, sitz baths, and dietary changes to ease bowel movements. Diverticular disease may require antibiotics or, in severe cases, surgery. IBD is treated with anti-inflammatory medications, immune system suppressors, or biologics. Polyps are usually removed during colonoscopy, while cancer treatment may include surgery, chemotherapy, and radiation. Infections are treated with appropriate antibiotics or antiparasitic medications. Peptic ulcers are often treated with proton pump inhibitors and antibiotics if caused by H. pylori infection. Angiodysplasia may be treated with endoscopic procedures to cauterize bleeding vessels. Preventive measures to reduce the risk of gastrointestinal bleeding include dietary changes. High-fiber diet to prevent constipation and strain during bowel movements. Drinking plenty of fluids to keep stools soft. Regular exercise helps maintain healthy bowel movements. Avoiding prolonged sitting on the toilet and straining during bowel movements. Using medications like non-steroidal anti-inflammatory drugs cautiously and under medical supervision. Regular screening for colorectal cancer, especially for those over 50 or with a family history of the disease. Proper management of chronic conditions like inflammatory bowel disease. If you notice blood in your stool, it is important to seek medical attention to determine the cause and appropriate treatment. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.